Good evening, everyone, and welcome to Critica.NYC. I am your host, Raquel Batista. And first off, I wanted to wish you all a happy new year. It's been a long while since we've been on. We took a break during the month of January, but here we are again. And this is a show focused on the life, work, and politics of the Latinx community in New York City and beyond. Today, we'll be talking about the Latino community and its access to the COVID vaccine. As some of you may already know and have heard and have experienced, there has been a lot of issues around the lack of access to the COVID-19 vaccine. And, nationally, there's been a lot of issues around, setting up the operation to get as many people who decide to get the vaccine vaccinated in the country. We know that now President Joe Biden has announced getting out 200 million vaccines immediately. So the work has been ramping up all over. But recently there was an article in the New York Times talking about this very issue, about the lack of access for Black and Latino New Yorkers. And in this article, they highlight the fact that 48% of the people who have received the vaccine are white, 15% are Latino, 15% Asian, and 11% Black, while the city's population is about 30% Latino and 24% Black. And so today we have two really wonderful guests joining us today. We have Angela Fernandez. She is currently a New York City Council candidate for District 10 in Washington Heights. She is formerly the commissioner of the New York State Human Rights Commission. She also was the president of the Dominican Day Parade. She was the executive director of the Northern Manhattan Coalition for Immigrant Rights, which is where she and I actually became friends when I worked there as well. And she's going to be discussing with us what it has been occurring in Washington Heights. And also we have George Torres, also known as Urban Jibaro, and he is the CEO of Sofrito Media Group, and he will be discussing his role that he's been playing in terms of doing outreach in the Latino community around the coronavirus, the pandemic, getting tested, and hopefully promoting the vaccine. But before we get started with the conversation, I'd like for us to watch a small video that Angela has shared with us on a recent protest that occurred at the Armory in Washington Heights.
This is about true community accountability.
Thank you for sharing that with us, Angela. So, Angela, why don't you get started? Tell the audience a little bit about yourself and what is happening right now in terms of access to the vaccine at the Armory, and what has been the response of New York Presbyterian and other officials.
Sure. No, thank you. And thank you so much for this opportunity. And, Raquel, it's always amazing to work on projects with you. I think one of our biggest projects was a smooth transition at NMCIR, Northern Manhattan Coalition for Immigrant Rights. So I live here in Washington Heights, and I think there are two positions that I've had that I feel are very relevant to what's been happening. And also in addition to being a resident of Washington Heights and using the hospital services. But as a former commissioner of the Division of Human Rights for the state of New York, when that article from the city was published early last week, where the disparities in who was accessing the vaccine looked, extremely concerning and very disheartening. And then as the ED of a community-based organization, where what you're doing every single day is adjusting and tailoring what you do in terms of an organization to ensure that people do not have barriers to access your services or anything else that you may be doing. So thank God for that article, because if that article hadn't been published by the city in early last week, I think we would never have known what was happening. Thanks to that article, I started getting calls from neighbors saying that they themselves had gone to the line and saw many people there that clearly did not look like that they were from the area because they looked a little bit disoriented. And also people were complaining that they could not access the appointment. And so we decided, they came to me and said, let's do something in front of the Armory to bring more attention to this because the problems hadn't been fixed. And granted, an institution like New York Presbyterian is a big institution. I understand it's not easy to shift gears, but on the other hand, it is an institution that is in our neighborhood. And 60% of their employees either live or grew up in Washington Heights. And one of the things that we learned as well was that many of these staff had told administration that only providing an online portal from which to secure an appointment was going to leave a lot of people in our community out in the cold. And this was before the rollout. So part of the protest was also to say to New York Presbyterian, you can do better and I want the hospital to be a successful and great hospital and accessible to our community. But you have to listen to your frontline employees. We spoke to the healthcare navigators and they told us that they just were not listening. So structurally, they're not set up to actually take in that information. And that's one of the things that we also wanted to bring attention to. Now, since everything that's happened, as of this day now, we know that New York Presbyterian put out what's called a community plan. So we've seen it. The first piece that they put out, which they've been doing for a couple of weeks, is asking the community-based organizations to help people in the community submit the online information to get the vaccine. We still have that barrier. And also, I think that if you're going to lean on the community-based organizations, then you need to compensate them. I know that the EDs themselves in some of these organizations are fielding the calls directly from people and setting up the appointments for them. They're doing it because they believe in service, but I think that NYP needs to really be super considerate and respectful of these organizations and provide them at least with some resources where they can hire someone part-time to make sure that everyone's getting vaccinated. Also, we would like to know how many people who are 65 and over live in the surrounding zip codes. Like, this is basic information that should be shared. And then how many of them are scheduled to get vaccinated? Additionally, we know our community. Our community will either do it via phone or go personally. At a minimum, the Armory should have had a booth that is for the people that come to the Armory because they heard in the news that Armory is doing vaccines, that they can go to the booth and then set up a vaccination appointment and come back with that appointment in hand. They should set up appointment hubs in some key corners of Uptown and Marble Hill and the Bronx. I know they're open to the Bronx as well, where when someone is actually out doing their shopping, then they can go and set up the appointment. We should be receiving weekly live zip code vaccination rates with ethnic, racial makeup, and their income. We should be receiving that as a public so that we know that this is happening. And finally, which is what I opened with, is that we need to have the hospital listen to their frontline employees. I mean, Raquel, you and I know that if you want to try and make any kind of change or improve, you have to have the frontline folks lead. And especially in terms of information and designing and strategizing, that's a resource that the New York Presbyterian Hospital is not using. So far, just to close out, what we see is that they're saying that they're working with the community-based organizations. We know the community-based organizations are working really hard, but they still don't have a hotline where someone can actually get an appointment via phone, and they don't have these appointment or these vaccination appointment hubs that I think would be truly, truly accessible and helpful for our community.
Angela, thank you so much for that. I mean, we have been aware that there has been just a general failure of the state to be able to respond to this whole situation of the pandemic. And we know the impact that this has had on the Latino community, where we have seen an overwhelming number of deaths related to COVID in the Latino community. So, this brings me to George. I know George has been doing a lot of work for the community before the pandemic, during the pandemic. I know he himself has also been impacted personally by this. So, we would really love to hear from you, your own personal takes on this, but also about the work that you've been doing to do outreach to the Latino community, to make them aware about what is happening and how things are occurring.
So first of all, thank you so much, Raquel, for having me. Angela, thank you for all the work that you're doing uptown. It's definitely appreciated. I have a different story. I had the opportunity of being approached by the New York City Health and Hospitals to be part of their COVID-19 campaign efforts to reach out to the Latino community. And as a result of that, I was able to actually get together some really, really good influencers / friends in the community to help get the word out. So my story is that I got approached to be in part of the campaign, and the day after I made the agreement, I actually got tested positive. I work as a flight attendant part-time, and spent quite a few some time away from home traveling. So I am a frontline employee. I'm somebody who is actually obviously high at risk because I'm constantly in contact with people in transportation hubs all over the country and internationally. So I was very concerned because my living arrangements in New York City, since it's not my primary home anymore, is kind of like a dorm. It's called a crash pad. It's like a dorm for flight attendants and pilots. So it's a place that we actually sleep at when we're here working. And when I found out I was positive, I didn't have a safe place to quarantine because now I was putting other people at risk by coming back to my crash pad. So I got in touch with, on a friend's advice, I got in touch with 311, and they put me in touch with the Health and Hospitals Test and Trace Corps. And they were able to put me in a hotel, LaGuardia Plaza Hotel over by LaGuardia Airport. They were able to put me in a hotel at no cost to me and provide me safe shelter, a medical staff of 24/7 that does wellness checks twice a day, 3 meals a day, etc. One of the best things about the wellness checks is that was actually the piece of the plan that actually saved my life. I always get emotional when I talk about this, but after being in a hotel for 6 days, I lost oxygen saturation. So my oxygen levels were really low, and they came into my room to do the wellness check, and I wasn't responsive. So they ended up rushing me to a hospital. I spent about, I want to say 2 weeks in the hospital. But if it wasn't for me having a safe place to actually quarantine and having that staff echarme un vistazo, like they say, I probably wouldn't be here today. So I have a very different take on what the city has offered me personally in this whole ordeal. I do understand that with the vaccinations, it's like the second piece of it, right? So we've been so focused on one piece that now the second piece is in play, and we're like, okay, what do we do? So I hope to be involved at some point to be part of the efforts, whether as a volunteer or as an ambassador, to be able to help people get access to those things that we don't have access to 100% right now. I think that everything that's happening in our community is really just what's happening right now. The pandemic is exposing inequities that already existed. And the only difference now is that people are really dying in droves because of these gaps. So I definitely applaud people like the two ladies with me here on the show, because you're actually, on the front lines, actually taking action and making sure that people know what it is they can do to make a difference.
Yeah, thank you for sharing that with us about that, George. I think that, yes, we understand that, there were a lot of big challenges, especially with the former administration that was in place, that was not, giving money to the states needed to be able to do and respond to this whole issue of the pandemic. We're hoping that now that we have this new administration with President Joe Biden and Vice President Kamala Harris and all the very diverse people that are now coming in, and now that also the Senate and the Congress has changed, that we will see, policies being put in place to really help, address these issues and to help the cities and the states to get the funding needed to roll out this vaccine operation, and that there is access for those who choose, right? Because I think, there's also the other side of all of this where there are people who are scared, they're wary, they don't want to get the vaccine as of yet. They want to see what's going to happen. People don't want to, subject to themselves to being like guinea pigs. And while there is a lot of science behind this, and there's been studies done, people still have those fears. And I would love to hear from Angela, if you can tell us a little bit about what are people saying to you about the vaccine. What are their concerns?
So it's really varied. Definitely, the demand is there. The demand is high here in the Heights and in Inwood, but definitely there are conversations where people are invoking our history and are very, very unfortunately spotty medical history in the way that exams, terribly cruel medical experiments were committed on African American men, Native American individuals, Latina and African American women. And so, one can't just turn a blind eye to that. When looking at a vaccine that was produced in record time. And what we hear from folks is, a vaccine for AIDS still hasn't been created, or I guess maybe there is one, but it took many, many, many years. But this one could be done in such a short period of time. So definitely there is some hesitancy, and it's typically when we look at the history, when it's people looking at the history of this country. But we also see, I hear more about the desire to get the vaccine, and the demand is high. Yeah. And I want to add one more thing about the experience of the kind of wellness check and care that you receive. And I think that's a perfect example of, what's possible. What could we do as a city where we'd have a 311 number that you can call and get a type of shelter where you're taken care of and you have wellness checks. I mean, imagine applying that across the board to all sorts of illnesses. And I think that's another thing that we need to take advantage of this situation, is that look at the new things we've created. Now, can we broaden that?
Yeah, I agree with that. I think that when you look at the pandemic and how it's impacted the community, we see a lot of things that we didn't think were possible that are possible. People are able to work from home. People are able to distance learn. You can lower tuition and have a robust online program. All these things are possible, but we were forced into it. And now it's like, whoa, like where do we go from here? You know what I mean? So do we apply the learnings? Do we really just go back to the way things were? Or do we really want to get back to that normal? Or do we want to apply some of the things that we've learned and some of the very special things that have come out of the pandemic and apply them towards a better society?
Yeah, thank you for that, George and Angela. I also think that with all of the competing ideologies around, whether someone wants to get the vaccine or not, the role of government here is to really create the access for those people who choose and want to participate to get the vaccines. I want to share, right, and as I've mentioned in the past, I am right now based in Georgia with my family. Both of my parents are over the age of 70, and they went and got their first shot of the vaccine this last week. They got the Pfizer vaccine. And, it was something, at least for the public health system in the county where I'm in, which is Gwinnett County. I was able to easily to go onto the website and set up their appointments, and I was able, thank God, to set them up, at the same time so they could go together and get their vaccine shots. But I know that this is part of the major obstacle in New York, because right now everything, it seems to be up to whoever is administrating the vaccine. Nothing is really centralized to be able to just get your appointment made. Why do you think that is just how it is right now, Angela? I mean, given that New York is New York, like New York is,
we have, so I had people who said, I went online. They didn't specify where online. I couldn't even find the option to be able to go to the Armory. Then it turns out they had to go to a different website. There's this, it's called eConnect, and that's like the website that, my understanding, it's linked with the hospital. But then you have the city website. So it's an unfortunate symptom of a dysfunctional relationship that I think exists among a lot of the institutions and exists between the city and the state, and we're paying for it. And don't get me wrong, like some things I know, like I think when they set up getting those hotel rooms that are for free for people to be able to isolate was excellent. I think that now the ways in which one can get tested for COVID right now, that system, that infrastructure, I think is excellent. But it always takes us a little time to get there.
Yeah.
And I think we lose lives when it takes time to get this. And just one more thing I want to add, as someone who ran a government agency, government agencies, although something like the Division of Human Rights was created because of agitation from the public that said we need government intervention and discrimination, yet to be outwardly facing is incredibly difficult. And part of it is also because there's no funding for it. So it's an interesting catch-22 that then we find ourselves when it comes to making sure the government is quickly responsive to marginalized communities.
Yeah, and I wanted to, build on that too, Angela, because, the experience of the hotel really came out of, the community really organizing and demanding that this gets put in place. And, we were really able to hear, especially from, elected officials and a lot of leadership, the importance of having, that set up. Mm-hmm. Right. And the fact that like people were no longer at that time really traveling to New York and all of that, like it was like, let's utilize this space. And I think that, and especially in a place like Washington Heights, and here we have a wonderful commentary from Gabriela Silverio, thank you, is the bureaucracy among the health partners and competition. This is dysfunctional. And I think, and I find it interesting in a place like Washington Heights that has such a long history of working with the local leadership in so many ways to really work on, access has always been an issue, right? Access around language access to get services, at the hospital. There's always been issues, but there's always been that line of communication. So, it really does, bring to me the question of like, why can't we get this to happen a little faster since the relationships already exist? and it's true, yes, the funding is needed to really, be able to assist in creating the structure.
But I think there's a key difference here, and when you have to have people in these positions that have worked directly with the community and truly being very successful at facilitating super complex either services or resources directly to the community. And so I think that, when the hospital provides a tour to the local elected officials before everything opens up, to show how everything, and I know, like, people have said that once they get inside the armory, it's wonderful. It's, it's all runs very smoothly. But there's a link missing in terms of accountability and knowledge, and saying to the hospital, okay, show me the phone numbers. Show me exactly how the community is going to access this. And I think that that's the kind of leadership we need. And most leaders don't do that. And I think that it is our responsibility, whether you're elected or not. But when you're elected, you have more power to do it. You have more formal relationship. It is completely legitimate to ask those questions and say, walk me through it, walk me through, just so I can understand this. Because if it's not accessible to the people I represent, then we need to go back to the drawing board and come up with another plan. That's all. Like I said, it's about making it better, but we need leadership that is not afraid to ask those questions and that actually want to look at those details and really kind of sweat the details and make sure that the rubber is hitting the road every single time.
Absolutely.
George, please tell us a little bit more, about the experience of when you were, putting everything together to do the outreach and the promotion around COVID testing to the Latino community. And what are your thoughts about what else could be happening that is just not happening right now?
So for us, it was let's see who we could identify that will actually be able to reach different people than I would just be able to reach alone, right? So that thought process was like, okay, so who do we have? So we engage people like Candy Calderon. We engage people like La Bruja, Fat Joe, Angie Martinez, Luis Guzman, Casper Martinez, Alain del Valle. I mean, there's so many different people. Alain del Valle. So we wanted to make sure we tapped into their audiences and that that they actually said it in their own voice, that they actually shared the information that we were giving them. That if you do happen to get together with your family, because it's New York, it's Latinos, we like to see our families. We miss our families during the whole pandemic. So if people were going to get together, that they made sure that they took the responsibility and got tested, that they made sure that when they were in between, that they were actually following all the different guidelines that the CDC had put out, washing their hands often, making sure that they wore a mask, keeping 6 feet distance, social distancing, and things of that nature. But in addition to that, that if for some reason they did come up positive, that they had resources, that they had a phone number, 212 COVID-19 that they can call, and they can get access to resources that will help people at risk or help lessen the risk for other people around you. And that was the main message. It was very, very focused on that. It was very focused around our experiences as Latinos. So the content varied. There was a lot of different conversations happening online, people being scared. I just had a situation a couple of days ago where a good friend of mine from Facebook reached out to me to ask me questions about my experience at the hotel, and she was having a hard time getting through to the number, and we started making phone calls and started getting other people involved in everything, and eventually we got her over to one of the hotel sites in Canal Street at the Sheraton Hotel, and where she's at right now. So I think she's on day 4, day 5 right now in terms of her recovery. But it made me feel really good that when people started having the questions, that I became somebody who they can go to. It was a resource. And I think that I could speak for all of the people that were involved in the campaign. They've seen some level of that. So we did what we were supposed to do. We did, we got results.
Great, excellent. And that's really great. And I really hope that they look to you again to, in terms of doing that outreach around the vaccine and informing people about the fact that it's here, it's accessible, there's places to go. But this morning I was listening to the news, and one of the things that they had mentioned is, for example, like rural communities are going to have a hard time in terms of being able to get the vaccine in, because, like, for example, Walmart and CVS and those bigger pharmacy chains have already agreed, right, that they're going to help in terms of doing the vaccine and getting it to people. But then, like, there are certain communities that may not necessarily have, right, a CVS in their community, or Rite Aid, or something else. They only have like their local pharmacies. Has there been conversations around that? And do you think that that's going to be happening on a greater level in New York City?
So we know that they just announced, the headline just came in about an hour ago, that delivery workers and restaurant workers are going to be prioritized next, and that at the same time they're going to start looking to distribute vaccines to pharmacies. But as we know, in New York City, the majority of the pharmacies are small businesses owned by a family. But I do think that we have to have a conversation about the privatization of things that are considered a public good. Health is a public good. And because our government public health infrastructure has been divested over the last 30 years because of a neoliberal philosophy that free markets will serve and respond to human need, which we know is not true. We knew it wasn't true back then. We now have ample evidence to show that it's not true 30 years later. But this is not having a public health system, a local public health system in place that's really ample, that can respond to these crises, and also provide much better health to our population when there isn't a crisis, is a problem, and it is directly linked to this concept of privatization. And so, yes, we've got the system that we have now. CVS and Walmart, they're the ones who have the infrastructure now. So we're not going to say no. But we need to really put pressure on our federal government and work with state and the city to start reinvesting into the actual infrastructure that is going to be a guarantee to help us all when we need it, and not be dependent on private corporations and on the free market.
Actually, Raquel, when you work as a flight attendant, one of the things that is part of our emergency protocols is identifying able-bodied people. If you ever sat in the exit row, one of the things that we always talk about is like, okay, well, are you willing and able to assist in case of an emergency? I just took my mom to get her vacuna in Florida, and I love the way that they use the resources of the churches and the local civic organizations in order to be able to carry out the duties and organize, even if it's just to be an auxiliary force to help the churches get this done. It took us about an hour and 20 minutes to get through the line for our appointment, but it was super organized, super efficient. And it wasn't because of government, it was because of the community. It was because of the role that the people in the church and the local organizations like the Girl Scouts and like the Lions Club and all these different other organizations were playing in the whole process.
But George, I agree with you on that, but not all communities have that. And I'm sorry, when we have healthcare insurance executives making more than $10 million a year, when we have, Jeff Bezos just says he's stepping down from Amazon. Yes, after you have hoarded all of the money because he has been on an anti-tax crusade across the world, he's got all the money. That's the money that should be invested in us. And I know, and I agree with you, George, but you know what? Those people are doing it out of the kindness of their heart. That's a great and wonderful, powerful thing about our country, but it is not enough. It should continue. But it's not enough because it's not equal across the country. And it's not equal in neighborhoods that already have been divested from in so many ways, and the people just don't have the time or the money to come together and do certain things. It rests only on a few people, what I've seen in some of our communities.
Yeah, and I just want to point this out, right? Because, you know, and I absolutely agree with you, Angela. And I think, you know, what George is saying is very true, right? Our communities, we step up.
Yeah, always.
We're going to get the money or we're not going to get the money. We're going to do what we need to do, right, to protect our communities and all of that, right? But this also comes down to, you know, essentially, like, what are our values as a country, as a state, as a city, you know? And this is what, like, a lot of the issues that came up in the presidential election and in the Senate runoff really comes down to this issue, right? In terms of, there are these values around capitalism, and then this is where, like, the bad word comes up of socialism, right? Like, really, what is the role of government when it comes to, you know, these social issues, right? That is not just, you know, bailing out the banks or bailing out the, you know, the big corporations when they're having a problem, but where is also bailing out, you know, people on Main Street, right? People who are being impacted by the day-to-day. And I know I'm kind of veering off a little bit off topic, but you know, we all also witnessed what happened recently in Washington, D.C. with the insurrectionists taking over the Capitol and resulting in the death of over 5 people. And even now, we're still seeing the repercussions of that insurrection, where people who have participated in the insurrection or were police officers on duty have, you know, committed suicide, are suffering trauma. Last night, we saw Representative Alexandria Ocasio-Cortez give her own testimony on what happened on January 6th in Washington, D.C., and the trauma that she has bared, you know, having experienced that, and other representatives as well, you know. And so as we're moving forward on this issue of the pandemic and how to address it and getting the vaccines out and trying to, you know, return to whatever the new normal will be, right? The question is this issue of what are our values and how will our policies reflect the values of the electorate. And, you know, I think that we're definitely in an interesting juncture. I think that while the insurrection may also have helped, right, by the new administration in terms of really, right, pushing forward, and the way they handled and managed the whole situation, I thought was just like really incredible to really push, you know, things forward. I know it also hurts us in a lot of ways, right? And especially immigrant communities, especially communities of color, because our issues kind of then tend to take a back seat, right? Because our issues are the ones that are the most contentious. And so, you know, just kind of, you know, bringing it back to all of this, Angela, if you could just, you know, also give me your perspective on how all of this has played out and how you think it's impacting locally.
Sure. No, I mean, I think it's really important to have lots of conversations about what happened on January 6th. And of course, we know that just didn't pop out of nowhere. That had been brewing, and also beyond the 4 years. So, you know, authoritarianism rises when the large part of the population feels economically insecure. And it is not a coincidence that when FDR implemented essentially all of these protections that we take for granted, like Social Security, he was deemed a communist. Okay, so let's just put that in perspective. What did he do also during the Great Depression? Bennett Avenue, all those buildings were built by the government. FDR employed all of these architects, designers, plumbers to build all of Bennett Avenue, and we're now benefiting from that today. Then we have World War II, And we have all of these men coming back to the United States. And the US government understood that if we don't ensure a path to economic stability, we are going to have a group of men that have been trained in war for 4 or 5 years have their own insurrection for economic security. And what happened? The only time in American history that we actually have a middle class is the 50s, 60s, 70s. People who made above a certain amount of millions of dollars paid taxes at 90%. That allowed for us to have accessible university. It allowed us to have a greater education in general. Health care was more accessible. And there were a whole host of things that you could work in a factory. You also had strong unions that ensured that when you were working in a factory, you were going to make enough money to be able to buy a house, send your kids to school. So we've lost that. The United States no longer has that. And so what happened on the 6th is a result of that, of government not paying attention and instead ensuring that corporations get bailouts when there's a crisis. I think what's happening now, for example, in 2008, 2009, what's happening now with the Biden administration, and they've said it, is that we want to make sure that this next influx of money that goes out is about putting money in people's hands. They understood the mistakes that they made. And so we're seeing more of that. There's still a struggle because the Republican Party thinks that the money should be going, any bailout money should be going to corporations rather than straight to Main Street, as you called it. But we have to have conversations about what happened in our history so that we are very mindful about how we handle this today. And I guess, on the ground here, I mean, people are, we New York City has, rents that continue to go up. We have an opportunity with a huge shift in power in city council, with over 30 seats of the 51 city council seats being new city council members, which provides great opportunity, but also we have to be careful. We have to make sure that those new city council members have worked in the community in a meaningful way. Otherwise, they're going to get manipulated by lobbyists. They're going to get manipulated by other elected officials who have more power. And that's really where we have to be fighting for. We have to be fighting to have new leadership at the city level, negotiating a $95 billion budget every year that actually understands what's at stake and is not afraid to fight for it.
Thank you so much for that, Angela. George, any comments from your perspective on how you see things in the country now?
Well, I'm not a political expert, but one thing I will say is that this is definitely a teachable moment. And I think that what people like us could do is continue to teach people the power of local government, because ultimately those are the people that we're trusting to make sure that systems like what's happening right now with the testing and the vaccinations actually go through the way they're supposed to go through, and that we do have access. So getting to know who the people are, the city council people, your senator, everybody that works on a local level within your community, find out who are the influencers that had their ear, so that you could actually be in the right place to have those conversations, to be able to hear what the concerns of the community are. There needs to be more town halls. And now we know with the pandemic that we don't have to be present in the building to have these meetings. We could definitely use the technology and leverage that to make sure that we're having the most important conversations, and that there's la gente está diciendo presente, so to speak.
Yeah, and George, I would love for you to also maybe comment a little bit about, in the Latino community, we've had a lot of losses, right? We've had a lot of people pass away who were leaders, innovators, people who were really, breaking the mold. And, now it's kind of like up to this, right, new generation, right, of carrying a new vision forward, right? And so, I would love to hear a little bit about what you think around, when it comes to like cultural activism and, artists and their role in all of this, what kind of support there really should be happening at this time.
Well, the artists I work with are very socially active. I'll start with that. And like, for example, poets, right? Poets are declamadores, right? They're the ones that carry the message of the pain of the people out there so people could actually heal. I think that what's happened in the community activism circle is that we've had people that we depended on so greatly to be leaders, and we let them take the helm, and they didn't do transitional plans. They didn't teach people the secret sauce of what they were doing. They didn't teach them who had access or who was helping them get the grant money, for example. They didn't teach people what the process is to actually apply for the money. So they held on to all this knowledge, and now they're not here. So we have to kind of go and figure things out. And in the meantime, the people suffer because we don't have access to the same capital that we once had, which was already limited. So I think that one of the messages that I would, and even in my personal uh, projects, Capicu and whatnot, we've actually talked about transitional plans, like what's next. My website, Sofrito for Your Soul, has been around for 22 years, and I want to make sure that it actually stays around way past my existence here on Earth. So I'm talking to local universities to find out if I could donate it to a local university and make it a writing platform for Latinx writers and artists. So this that kind of thinking. We have to really start thinking about how we're going to take whatever we do the best and actually teach others to do it as well, so that they can come up with new ideas and obviously evolve the access that we have.
Thank you for that. And you also have the Siembra initiative.
Yes. So Siembra, Siembra is actually was my company's response to the pandemic. A lot of people who are working in the community, a lot of people who worked in media were losing their jobs. Some of them had dreams of creating their own companies and working for themselves and escaping the whole 9 to 5 or 9 to 9 paradigm. I created a group with about 150 small business owners and creators, and started giving them social media marketing advice and started helping them shape their own projects so that they could thrive. And I have to say that out of the 150, I could say easily a good 2 dozen people have launched really meaningful projects that are actually thriving today, despite the pandemic. So we're looking to grow that initiative. I'm not really sure what direction we go in. I'm exploring different options. I definitely don't want it to be a nonprofit. I want it to be something that promotes people actually being abundant in the community. So I'm working on some things right now that are hopefully going to continue that spirit that we started during the beginning of the pandemic, and just kind of grow that siembra. It's time for cosecha, right? We've been cultivating for a long time, so it's time for cosecha. That's what we're working towards.
Well, the spring is coming soon, so hopefully we'll see a lot of the fruits of labor come out during the spring. And so I also wanted to just take a look at a few of the resources that I was able to find online. Just wanted to make that accessible to the public. If we can show the form on who is eligible as of right now to be able to get a COVID vaccine. This is the website from the New York State COVID-19 vaccine form. This form does not get you an appointment, but it will help you to identify who is currently eligible to get a vaccine. So it's either you're 65 and over, or you meet one of these various points, and so you would be eligible to get a vaccine shot. So if you have a computer at home or you have your phone, definitely, go online and take a look at that form. It will ask you for your name and your address and your demographic information. And all of that will be important, to help you in moving forward with that. Thank you for that. And we also have available the information, some website information that I was able to find from New York State, from New York City. We have information on the COVID vaccine. It's for New York State. It's COVID-19 vaccine.health.ny.gov. And there's a hotline. The hotline phone number is 1-833-697-4829. So please, you can use that phone number, and hopefully they'll be able to connect you to where you can go. New York City, you go to vaccinefinder.nyc.gov. And there, then it would give you the information for the site that's near you, and then you would have to contact that particular site. This site does not give you the ability to make an appointment. This is just to find where the vaccine is being given close to you at home. And then also, I have the information here from New York Presbyterian. We found vaccinetogetherny.org, or call 646-697-VACC, VAC, 646-697-VACC. So we'll have that information also available for our viewers. And hopefully that will help you to gain access to the vaccine. And I'm sure also you can always call, can they call 311? Or no?
I know for Uptown, they can call the organizations, the community-based organizations. The number that you listed, I think, is the number that just takes you into a tape loop and then back into the website. So I think that that's something else that would be great for the hospital, is to put out the exact number for each of the organizations that our community members could call, because sometimes you call a nonprofit and it may not be the right number that gets you directly to a person. So I don't know if you can dial 311 for vaccine guidance.
All right. Okay.
I don't know, George, if you would know.
So yeah, so the Health and Hospitals Test and Trace Corps, they have an amazing amount of resources. It goes way beyond the hotel program and what we discussed here. So yeah, you could definitely get some basic information from them. And they could just guide you in the right direction for that information. But I guess I'm gonna get together with you, Raquel, and try to see if we could put together something a little bit more cohesive that we could send out to everybody. But we have to test. That's the one.
I think it's important to test the numbers.
Exactly.
And then dial para español. Dial. See
make sure it's what you said. You have to walk through the process to make sure that it works. I could talk about Test and Trace Corps because they saved my life.
Yeah, of course. No, clearly it worked, which is great.
Yeah, clearly it worked, right? But I think that's really important. If you get a number, if you get a resource, make sure that it works before you start spreading it out there, because people get fatigued.
Yeah.
They keep getting information that's erroneous, is fake news. They get tired and they start tuning things out. So let's make sure that we're being responsible as communicators and making sure that we're getting the right info out there.
Thank you for that, George. I think that, definitely while, and again, I just want to, put this out there because I have some people who are very close to me who, aren't sure, they don't want to do the vaccine. They're not interested in vaccines. That's not the path they want to take.
Mm-hmm.
And, I do respect people's personal decisions as to, what medical, things they want to participate in, what they want to do with their bodies. Right. But, for the people who do want to get the vaccines, for the folks, especially, folks like of my generation, right, where what they call, the sandwich generation. We're taking care of our children and we're helping our elderly parents, right? And we want to make sure that we protect that older generation that has been so severely impacted by this pandemic. And I know, for example, with my parents, they really want to travel. They want to go to the Dominican Republic. They have business to take care of. You know how our people are, right? They have things to do. And so, hopefully we can get to that point where, I'll feel safe, they'll feel safe on the safer side, and that we can, avoid, anything tragic from happening. So, we have a few minutes left. Angela, I'll give you 1 minute if you want to wrap up, and then we'll hear from George.
Just kind of echoing what George said about that civic engagement, the people, just ordinary people coming together and actually really being super helpful. That's one of the great things about our country. And that also linked to that is the organizing piece, that, when something is not working is also calling attention to it. And so I think that what we saw happen this summer with the international protests is critical in doing a consciousness shift. And so I think that we're in the middle of that consciousness shift also in terms of what can these institutions do better. And I'm excited to do that in partnership with anyone who's interested. And I'll just also just say, you can, check out my website, AngelaFernandez.NYC. And you can follow me on Instagram, which is Uptown for Angela, to learn more about what we're doing and what we're building here in Uptown, which is a movement that will really do new things and different things here that will help a lot of people.
Thank you so much for that, Angela.
Thank
George,
you.
any final words?
I want to give a really big shout out to Led Black from Uptown Collective, because he was such a big piece of this campaign. He's a very quiet guy behind the scenes, but he did more than his fair share when he joined the initiative with us. So big shout out to him. I'm gonna do the unthinkable right now. I'm gonna give you my phone number. I'm gonna have you text me if you want to be part of my cultivating team of people that actually just do good in the world. All right. So that number is 917-708-5118. Okay, again, that's 917-708-5118. Text me, #WEPA. Let me know that you're interested in actually being part of a collective that just is out there doing good, that's spreading the word about initiatives that matter. And hopefully we could do things that'll actually make the world a better place. Thank you.
Thank you so much. I want to thank Manhattan Neighborhood Network, Zenaida Mendez, our executive producer, Freddie Pinto, the supervising manager at the Manhattan Neighborhood Network, and all of you for joining us today in this really critical conversation. And I hope to see you all again in 2 weeks. Thank you so much.
Thank you.
Thank you.